I'm Sandy Bussell with the Plastic Surgery Group, and my function is I'm a super user.
I'm Anne-Marie Kays, a nurse for one of the physicians and then the clinical manager, and also a super user at the Plastic Surgery Group in Cincinnati. We have 6 physicians, 3 different offices, Northern Kentucky and 2 in Ohio, and 4 nurses, 2 medical assistants. We do reconstruction in addition to cosmetic, all aspects of cosmetic surgery. 2011 we started the practice management,
Right.
And then about 6 months later we started with the EMR. Huge,
Yeah.
especially because we have 6 different doctors that all feel differently about things.
Right.
And so we're able to kind of put in things that they like and customize it to them. So for sure, because the main user in Cincinnati is, you can't change anything. The main electronic medical record company
Right.
is very unflexible. So
Right. You conform to them, they don't
Yeah.
really conform to you. So. It's nice that they can have the information uploaded at one site and then they go back to, like, see, our main offices in Ohio. They don't have to transport things outside of the office, and it's all there. And the main billing is the main office has all the billing, so all the Kentucky people and everything have, it's all there. So we don't have to worry about who had what or what super bill and all that stuff like that. So I think it's been very helpful in that respect.
from the clinical side of things, I can take calls for any of the docs because I have access to the patient chart from wherever I am. And I also can keep an eye on the waiting room in a different office and see how we're doing with patient times and who's been seen if they haven't been seen yet. I can actually look in the chart and see what the doc's charting at that time. If I have them see somebody for me, for a different doctor, I can see what's happening at that time.
We actually can truly track marketing stuff much easier, and demographic-wise, where it's coming from, things like that was harder to collect from the old system we used to, which was just billing. It was harder. Now you can it's much easier to track and see where our marketing dollars are going and how much stuff is actually from the outside market and what we're doing advertising-wise, as opposed to referrals and things like that.
If a patient calls me with a question, I can look up their name very quickly, even if I'm covering for another doctor's calls. I already know what medicines were called in. I already know what their last note said before they explain their problem, and I think it improves patient relations that way. Because I can say, oh yeah, I did call that in for you yesterday, how'd it go? Or, I just think it makes them feel like you're really paying attention to them, where before you'd have to say, well, could you hold on a minute, I have to go run and get the chart.
Right.
Can't find your chart, could I call you back? You don't have to do that anymore.